Immediately following treatment, what we see is some vascularization or some damage to the superficial skin cells at the very top of the skin, at the epidermis. It's at the base of the epidermis, which are the cells that kind of make the barrier between us and the outside world. And it's only about 1 millimeter thick. And so immediately after treatment, we see damage to some of those cells. In addition to expanding the size of this Grenz or border zone, we also kind of get rid of some of the solar elastosis, or the bad elastic tissue that comes from the sun. And what we see 10 days out is a zone filled with cells, many more cells that are normally present in skin, which basically cause creation of new skin, new collagen, new elastin, new dermis, to separate further the outside world from the bad sun-damaged part of our skin. So what we see 2 days following treatment is an intact surface or epidermis that covers the skin, and a zone of altered tissue which is still there. And that altered tissue stimulates a healing response while the old epidermis is still covering the treated area. So what you get is regeneration without an open wound. So then what we see 10 days following treatment is you see lots of new cells, fibroblasts, that come in. These are cells that make collagen and elastin in skin. And they come in for basically causing increased generation of new skin just beneath the surface. That zone just beneath the surface of the skin is where repair takes place following almost any treatment modality, following retin-A treatment or retinoid treatment, following alpha hydroxy acid treatment, following treatment with CO2 lasers or erbium lasers. That thin zone of normal appearing skin, which we call a Grenz or border zone, separates the epidermis from the abnormal solar elastotic material, or solar elastosis. This is because the epidermis needs viable skin to sit on. The epidermis has no blood supply. It's totally dependent on the underlying skin for nutrients. So that epidermis is smart, and it actually secretes growth factors to create a nice zone of normal skin above the damaged, sun-damaged skin, so that it can receive nutrients and kind of have a healthy existence.